Hip dysplasia in canines is a complex and debilitating orthopedic condition that affects the hip joint. It's a developmental disorder characterized by an abnormal formation of the hip joint, leading to instability and poor congruency between the femoral head and the acetabellum. This results in a loose and unstable hip joint, which can lead to various degrees of joint degradation over time. In a healthy hip joint, these two structures fit snugly together, allowing for smooth movement and weight bearing. In dogs with hip dysplasia, the femoral head and acetabellum don't fit properly. This can lead to a variety of issues. Cranial displacement, the femoral head may sit more forward than normal in relation to the acetabellum. Lateral displacement, the femoral head may sit further away from the center line of the body. And dorsal displacement, where the femoral head may sit higher in the acetabellum than it should. Hip dysplasia is a relatively common condition in dogs, especially in certain breeds. It can affect dogs of all sizes, but it's more prevalent in larger and giant breeds. Because of its frequency, many dog owners may encounter this condition at some point. Hip dysplasia is a chronic condition that progresses over time. If left untreated, it can lead to severe pain, decreased mobility, and a decreased quality of life for the affected dogs. Early detection and management are crucial to mitigate the long-term effects. There can be misconceptions about hip dysplasia, such as assuming it only affects older dogs, or thinking it's just a normal part of aging. Raising awareness about the condition helps dispel myths and encourages responsible breeding practices. While there are treatments available for hip dysplasia, including medications, physical therapy, and surgery, managing the condition can be challenging. Treatment plans need to be tailored to the individual dog's needs and may require ongoing care and adjustments. Hip dysplasia can significantly impact a dog's overall well-being. Dogs with severe hip dysplasia may experience constant caudal pain, difficulty walking, and limited physical activity. This affects their ability to lead a fulfilling and active life. Some dog breeds are more prone to hip dysplasia due to genetic factors. It's essential for breeders and potential dog owners to be aware of this risk and make informed decisions about breeding dogs to reduce the prevalence of the condition. While it's not always possible to prevent hip dysplasia, there are steps that can be taken to reduce the risk. This includes responsible breeding practices, maintaining a healthy weight for dogs, and providing proper nutrition. Additionally, early detection through regular checkups can lead to more effective treatment and improved outcomes. Hip dysplasia can be bilateral, affecting both hip joints, unilateral, affecting just one, and it's also possible for the contralateral hip in unilateral cases to become affected later in life. It's typically a chronic condition that develops over time, starting in young dogs and progressing as they age. However, it can be influenced by genetic factors. Clinical signs of hip dysplasia include lameness or limping, especially after physical activity, decreased activity or reluctance to exercise, stiffness and discomfort, particularly when getting up or climbing stairs, a bunny hopping gait, as seen in this picture, where the dog moves with both hind legs together, muscle atrophy in the hindquarters due to reduced use of the affected leg. Inflammation may occur in response to chronic instability and wear and tear on the hip joint. This inflammation can lead to pain and discomfort. The inflamed joint is often referred to as the hip joint itself, and the condition is known as hip synovitis. To diagnose hip dysplasia and evaluate the severity, various diagnostic tests can be utilized. In young dogs, two methods can be used: the pen-hip method of X-ray and the palpation method called the Ortolani sign. In older cases, a veterinarian will perform a physical exam to assess the dog's gait, range of motion, and pain response. X-rays are crucial for confirming the presence of hip dysplasia and assessing its severity. Specific views are used such as the ventral dorsal view. In this view, the dog is placed in dorsal recumbency. The X-rays are taken with the X-ray beam directed from the ventral side to the dorsal side. The hind limbs are extended and parallel to each other. This view provides a clear image of the hip joint's congruency and helps assess the presence of hip dysplasia. In addition to the ventral dorsal view, an extended hip view may be taken to provide a more comprehensive evaluation. In this view, the hind limbs are extended straight backwards, which can help reveal additional details about the hip joint's condition and the presence of secondary signs like osteoarthritis. In summary, hip dysplasia is a chronic orthopedic condition affecting the hip joint in canines. It's characterized by abnormal hip joint development, leading to joint instability and potential inflammation. Proper diagnosis and management are essential to alleviate pain and improve the dog's quality of life. Diagnostic tools like X-rays and clinical signs aid in confirming the condition's presence and assessing its severity. For additional information about hip dysplasia, please visit any of the sources listed below.